Hey there, everybody. It's Dr. Eric here. I wanted to give you some information about a conversation I just had with a dear friend of mine who's been a patient of mine also for, 7, 8 years now. And his name's Paul. Paul's a great guy, amazing dude, known him forever. Super cool guy. Guy's literally an ex-rock star. Used to play bass guitar in Chuck Berry's band back in the day. So he's got some stories. And him and I were talking about a conversation that he just had with his cardiologist. And Paul's in his upper 70s, really cool guy, neat dude. And he goes to his cardiologist about 5 years ago. And he's like, Paul, you got to stay on these medications. You're going to have a risk for stroke, heart disease, all this kind of stuff. And so, over the course of some time, we helped him naturally lower his cholesterol, balance out his blood. I mean, the guy is healthier now at 78 than he was at 28. And so long story short, I had to have a conversation with Paul about nonsteroidal anti-inflammatories, about NSAIDs, and how the FDA, and I wanted to read this, I got it on my phone here, how the FDA just strengthened the warning on nonsteroidal anti-inflammatories like Tylenol and these things that you're taking over the counter because of the higher risk for heart attack and stroke because people are taking these things all the time. And people, don't realize the risk of these drugs. And Paul's had off and on musculoskeletal pain, for years. Long story short, he was able to get off his meds by finding the cause of his problem, yada, 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 chiropractic care, all that stuff has really helped him changing his diet. But he had a conversation with his cardiologist who's been a cardiologist for years, and he showed him this stuff. I printed this up for Paul and said, take it to your doctor so that he can see it. And the guy was blown away. He didn't know that he shouldn't be telling his patients not to take nonsteroidal anti-inflammatories. He didn't know that there was a higher risk for cardiovascular disease. He didn't know there was a higher risk for stroke for that. And he's a heart and stroke doctor. And the guy didn't know. I mean, my question is, how the hell don't you know? So you got to get informed and don't let your health be limited by what your doctor does and does not know. So, the risk of non-prescription anti-inflammatories over the counter is ridiculous. And it actually says right here, it's a Consumer Report Watch that says, please, you should not take more than 2 different types of nonsteroidal anti-inflammatories at once, because that increases the risk for not only heart issues and stroke, but also kidney and liver damage. And then it says also on here, what should a consumer do? Number one, it says on here, and this is FDA saying it, consult with your doctor, which Paul did, and his doctor didn't know, who was a cardiologist, okay? If you've had a stroke or if you've ever had heart issues, you should never take this stuff. So then I'm going to tell you, what should you do? I mean, there are natural anti-inflammatories like turmeric or curcumin. There are things like high-dose omega-3 oils, even high-dose vitamin C, vitamin D3 in high dose, lots of water, and an anti-inflammatory type diet are things you can do to reduce your inflammation and pain. Also, finding the cause of a problem and fixing is always a good idea as well. Chiropractic care, good nutrition, exercise, the stress programs that we use in our offices. These are all good. I wanted people to know that taking these non-steroidal anti-inflammatories, it says right here, it can kill up to 37,000 people a year with this stuff. And that's pretty damn scary. But again, most people don't know, and certainly most doctors don't know. So again, if you want more information about this, go to NeputeWellnessCenter.com. We've got an article on there. We did a radio program. We talked about this just recently on the risk versus benefit of taking non-steroidal anti-inflammatories for pain control. And the bottom line is you shouldn't do it. And I'm telling you, this stuff's been around for a long time, long enough now where people can actually see and study the effects of it, and more things are going to come out in the future saying, hey, drugs are bad. I firmly believe that our society is going to look back, 15, 20 years from now and go, man, I can't believe all the drugs and vaccines and surgeries we needlessly gave these folks and called it healthcare. So listen, it's all about finding the cause of the problem. I just want to give you a video on that. Y'all have a great day. I'll see you the next time I see you.